When you step onto the Mayo Clinic campus, you can't help but have this feeling of being awestruck, of wonder. The Gonda building is just huge marble pillars and everything is gorgeous. And it really is everything that they say it is. You know, you hear the Mayo Clinic name, you think you'll be let down, but you won't be. It's like the Disneyland of hospitals. It's the most amazing place.
My first time that I visited Mayo was actually when I was pretty young. I was around 7 or 8 years old. And I have a very distinct memory of walking into the Gonda building and seeing the giant marble pillars and the giant statue. There was someone playing on the piano. And I remember at that time thinking that this was a really special place. And so on my first day, when I came back here as a resident, I got to re-experience that. And it was really an emotional moment for me to kind of come full circle and be here as part of the Mayo Clinic versus just someone visiting.
So the question is, if I could describe this group in one word, what would it be? And that's a completely terrible question because there's just not one word to describe this group of people. They're all amazing, but we have people who train here who come from all over the country. They've trained at small schools, at big schools. Their goals are to go into private practice or to go into academics. Some do fellowships and go into private practice. And we just have a reputation of training amazing surgeons who accomplish wonderful things and go out and do a variety of things. And I think that's what we're most proud of.
But wow.
Wow. Wow is also a great word.
I think first and foremost, in any training program survives on being able to see a lot of patients and being able to see a lot of patients with a lot of different types of disease process. I always tell people what you want out of your residency is you want to have seen almost everything. You don't want anything that when you walk out of here to be something brand new. You want to say, I've seen that before. I know how that's handled. I handled it myself. I've watched my mentors deal with this situation. It's almost certain that they will have seen just about everything that they're going to encounter for the rest of their career during their residency.
One thing that really sets this program apart from where I trained is that the residents really take ownership in the patients, and they feel like because they see the patients both in the operating room and the clinic throughout the 10 or 12-week time that they are the provider. They look at each patient as their patient, not as my patient. So they'll go in and see the patient and have a plan, and we'll talk about it, and then go in together and tie up the appointment.
Here at Mayo, when you join the residency program, you're working with multiple surgeons with different approaches, different preferences, different ways of doing things. So you're able to see there's not just one way. You get to work with a large group of people that are here to see you propel yourself into your career.
We come together as a group in otolaryngology. We see clinic together. We bounce ideas off each other. We help when we're flooded with questions from patients over the phone. I feel like we always come together as a team to meet the needs of the patient.
From the person who's taking the phone call at the desk to every single nurse and tech I've ever worked with in the clinic or the operating room, everybody feels a part of that team. And everybody feels like they have a part and a role to play that's going to add to that patient experience.
I think the unique thing about Mayo Clinic is that we are a very large facility in a fairly small town.
As a husband and as a father of 2 boys, my favorite part of living in Rochester really comes down to how easy and friendly the location is. Rochester is easy for families, it's easy for individuals. Being a resident is made incredibly simple to come to work and do your job.
Occasionally I'll bump into people, and it's just so great to feel like we have a relationship where we can just get to know each other a little bit better. I also always try to make a point to take my residents that are on my service out for coffee or lunch once in a while while we're working. Those days get busy, and it's nice to have that break where you get to know them a little bit better and really figure out what they want in life. And I think that's just an awesome part of my job.
The other residents, they're some of my closest friends, and I really love all of them.
I do see us as a family in a lot of ways. We are very close in our interactions, both at work and at home. Some of my colleagues are my closest friends, and we'll hang out after work or on the weekends. Our kids do activities together. Between the residents and the consultants, we do events, and we have formal events as well, which can be very rewarding, and these are things families do together.
Most exciting part of residency and every day for me is just patient care. I wake up excited every day just thinking about how I can help the patients.
It is such a privilege to come to work every day and you see patients and they say, "I'm sick, make me better." Through your experience, through your training, through the way that you operate your hands and the art form that is surgery, you are able to make them better. And that is such a privilege and a calling. And I can't think of anything else I'd like to do.